Good afternoon, everyone. Welcome to our Instagram Live. This afternoon, we're going to be talking about male to female gender confirmation surgery. And I hope you have lots of questions, and we look forward to being able to answer as many of your queries, concerns that we can. This is all about supporting you and helping to better understand the procedures that are available to you. We're just looking for Laura. Here you go. And hopefully we'll be able to cover as many things. Hi, Laura.
Hey.
We lost. Oh, that's right. Your hair looks lovely this afternoon.
Thank you.
Good. We're all ready for lots of questions.
Yeah. So Nicole has sent me through quite a few questions, and one of the first ones which we had was, do we perform vaginoplasty?
Yes. I can say. Whoops. Sorry. I'm just trying to get my volume up a little bit better. That's better. Yeah. Yes, we certainly do. My preference for vaginoplasty is really used in patients who have very little tissue originally, so very little penile tissue, very little scrotal tissue, or patients who have had a failed first procedure. So very commonly used as a revision vaginoplasty. The colon makes an excellent neo-vagina, and really provides good length, good caliber for the neo-vagina.
Yeah. And is there any additional risks with that procedure rather than just, for example, full gender confirmation surgery?
Yeah, there will be additional risks associated to the harvesting of the bowel segment. Like in all bowel surgery, the potential for a leak in the bowel when it's reconnected. There's that risk of infection associated with that part of the procedure. In the long term, realistically, with good surgery, with combining it, it's a procedure that we do jointly with one of our bowel surgeons, who are very experienced in both laparoscopic and open procedures. The risk of leakage, the risk of complications like that are exceedingly low. You're talking about risks that are less than 0.1%.
Yeah, absolutely. And if that were the case, that you were looking to have vaginoplasty for any of those reasons, what we would do is we would have a consultation with you, but we would also get you to see our other surgeon as well.
Yeah, absolutely, because it needs careful assessment and proper planning to ensure the safety of our patients and to make sure we get the result that our patients want.
Yeah, absolutely. Another question regarding hair removal actually was, can laser be used rather than electrolysis?
Yeah, hair removal. The goal of hair removal is to remove the vast majority of hair follicles as possible, and really to minimize. The reason is to minimize any intravaginal hair growth or hair growth around the opening of the vagina, what's called the introitus. Whether laser is suitable or whether electrolysis is better really depends on the color of the skin and the color of the hair. The darker the skin, the lighter the hair, is the more the need for electrolysis. So very pale skin with dark hair are ideally suitable for laser hair removal.
Yeah. And if you're looking for the diagram of area which we require for hair removal, it is actually on our website. Yes. So you can check that out. And there's an image on there with the area which we require for hair removal. So another really good question was, being on testosterone blockers, is it possible to achieve a good result despite having been on blockers for many years?
Yes, testosterone blockers really don't influence the possibilities for your surgery. Um, you know, I guess the question is kind of geared more towards the young trans individuals who have started pubertal blockers or testosterone blockers at a very young age, and therefore genital development is reduced because you've removed the stimulus to that development. Um, these patients, despite that, because we use a peno-scrotal flap procedure, so that means using all of the penile skin as well as the paddle of skin from the back of the scrotum, means that in very few patients we cannot achieve a good vaginal depth and caliber using that. It because of early use of testosterone blockers, androgen blockers, or starting pubertal blockers at a very young age, it means that certainly a straightforward penile inversion procedure will probably not give an adequate vagina.
Yeah, absolutely. And just moving on from that, do you want to explain the peno-scrotal flap technique?
Yeah, so the two big differences is that the penile inversion only uses the penile skin as a tube to turn inside to create the vagina. That means that if you've got fairly small penile development, then you are limited to the size of the neo vagina that you can achieve. Uh, so. But on the other end of the scale, individuals who are well endowed preoperatively, there's really no problem with doing a penile inversion. So for the vast majority of our patients, we use what's called a peno-scrotal flap procedure. That means using all of the skin of the penis, which is unfolded to create a flat bit of tissue.
Yeah.
So imagine all of that's the penile skin that's been opened out, and then the paddle of skin from the back of the scrotum, and those are joined together to create the tube, which is then inverted into the vaginal space.
Yeah.
That means that we achieve a good vaginal caliber and also depth with healthy living tissue that has sensation, has normal behavior as healthy skin. It's not a skin graft. It's not transplanted tissue. It's living healthy tissue.
Yeah, and actually going on from that question, another question which we got in was regarding sensation, and is sensation guaranteed after surgery?
Yeah. I would be very careful about using the word guaranteed. We do observe the nerves to the skin of the penile tissue, as well as the skin of the scrotal tissue. So our expectation is after a period of healing, which could be anywhere from 6 weeks to 6 months, the sensation should recover completely.
Yeah, and from seeing the patients post-op myself, I would say anywhere from 6 weeks to 3 months. That's when a lot of patients say, yes, they're gaining sensation back.
Yeah. And the real benefit of using that tissue is that both of those tissues have good erogenous sensation.
Yeah.
It's not just skin sensation, it's good erogenous sensation. So it means that adds to the benefit of the sensory recovery for vaginal intercourse.
Yeah, and like you said, we're not using a graft, so we're not actually taking the skin off. Therefore, everything is still essentially attached, including all of the nerves when you're inverting the new vaginal canal.
Yeah, absolutely.
I just seen a question come in there actually. It was in regards to multiple sclerosis, which affects their mobility and flexibility of legs. Is there any reason why they may not be suitable for a vaginoplasty?
Really, really important question. And it would be very uncommon that we would not be able to get you in a position that would facilitate the surgery. And that's
Yeah,
something that we would have to assess at your face-to-face consultation, just to look at the limitations of your movement. And it's really your hip flexion is the most important thing, as to whether that there is any limitation of that. And you know, a lot of times with this type of surgery, it's about looking at solutions. It's looking at the problem and finding a solution.
yeah, absolutely. Um, Another question, which is a very good one. Can GCS and breast augmentation be performed together?
Absolutely. You know, it's very much about you, the individual. If you're healthy, you don't have any medical problems, which would complicate your anaesthetic and your recovery, and very much ensuring that both procedures can be done safely
Yeah,
without any one compromising the other. So yes, something that we do quite often. We combine breast augmentation or with gender confirmation surgery, or we combine tracheal shave with gender confirmation surgery. So it's looking at what's safe, and ensure that both procedures can be done safely at the same time.
yeah, absolutely. And something which, you're able to recover from together as well,
Yeah,
that it really alter that progress or that recovery. Um, Another very good question actually is the aftercare tough? So is it hard post-operatively?
I'm
I
gonna
would say,
I'm
yeah.
gonna let you answer that one because you've got, yeah.
So I would say the first week you are in hospital. Okay, so you're staying in hospital for those 7 days and you're on bed rest for the first 5. I would say mentally that is probably the hardest part. Um, when Mr. Inglefield will visit you every day, probably twice a day, for those 7 days. And usually what we find is that it's not that the patient is in any pain or discomfort. Usually pain levels are right at 0. It's very, very rare that we would get patients saying that they're, in a lot of pain or discomfort. It's more just laying there because they're laying there for so long. Their mind just gets a bit bored. So it's about trying to, keep yourself occupied that way. In normal times, you would have, your visitor in, chatting with you, then you can have a snooze and things like that. I would say that first week is just, that would be mentally the hardest. After that, you will see us very regularly for the following weeks, pretty much up until you reach 6 weeks post-op. And I would say most patients, when they leave hospital, that's when they're really on the route up. They feel a lot better when they're up, mobilizing, in their own space and recovering from their own home. I would say, again, not much of it is pain. It's just more discomfort of trying to figure out how to sit down or how to lay down, which is a comfortable position for them, because what you have to remember is your anatomy is completely changed. So even things like walking and sitting and laying are going to feel slightly different. So it's just about getting used to that. But most of my patients who we see post-op, honestly, the pain is very, very reduced. They will be coming back 2 weeks post-op, no pain, 0 pain out of 10, feeling very, very well in themselves. It's just about getting used to sort of their new routine and how things are feeling.
Yeah. And there's no doubt that dilation or dilatation can be very uncomfortable initially because the tissues are swollen, they're still healing, they can feel a bit raw. So we make sure that we give you medication to help you relax, help the muscles relax.
Yeah.
That initial 2 weeks until things start getting better. But it's all about learning, as Laura said. It's about learning and adjusting to your new anatomy, and what feels good for you, what isn't comfortable, so that you learn how to manage during the day. But as Laura said, it's very manageable. We certainly do as much as we can to ensure that your journey through the whole process is as comfortable as possible. We don't want you to be suffering in pain. We don't want you to be unbearably, finding it, very difficult. It's about making it as good as possible for you.
Yeah, absolutely. And that is why we always give you access to our 24-hour, 7 days a week emergency services. One of us nurses is on call that whole time. So if you have any questions or worries, you get on the phone to us straight away. Even if you think maybe it's a silly question, it doesn't matter. We want your brain to be at ease so that you can recover the best.
Yeah.
Yeah. I'm just seeing. Oh, someone did ask when they can engage in sexual intercourse after their surgery.
Surgery, yeah. So we recommend that you avoid any sexual intercourse for 3 months after surgery, and that includes any type of sexual intercourse, because any sexual activity will increase the blood flow to the area and can cause additional swelling, delay healing, and certainly any penetrative intercourse could cause injury to the healing tissue. So after 3 months, you should be safe, and we will guide you. We will advise you, if everything's, even at that 6-week appointment, we will advise you that, things are healing well, they're going according to what we expect, and that you shouldn't have any problems. And that's very much, you will know that yourself by how your dilation is going, and you will know that if your dilation is going well and you don't have too many problems, that you should be fine to engage in penetrative sex after that 3-month period.
Yeah, and regarding exercise as well, we usually advise around 6 weeks, but really it is patient specific. I believe as well, with especially this surgery, some patients may feel at 6 weeks things still feel just a bit precious, more so than anything, and you just want to be extra careful, and they may just take another few weeks before they feel completely ready, and then they'll start back with low impact exercises and just build there.
Yeah, exactly. And as we talk about all the time, it's about listening to your own body.
Yeah.
You know that certain things you will be able to do quite comfortably, and other things would be a bit more difficult. And you listen to your body, and you work out what you can do, and you just progress with your exercise routine, depending on how comfortable you feel.
Yeah, absolutely. Things like walking, you will be able to, once you leave the hospital, walking is fine. And we do advise that you do get out, every so often for a little walk. And again, just listening to your own body, because you will want to rest as well.
Yeah.
So,
question about is the follow-up, all the follow-up appointments included in the quotation? Yes, absolutely. I've always maintained the principle that if you trust me, you trust our team to do your procedure or surgery, then we have a responsibility to look after you and make sure things heal as we expect, and you get the result you want. And therefore, it's a package. We don't discount that package if you don't want to come back and see us. If you don't want to come back and see us, we simply won't do your surgery. So it's all included in your in your fees, and that includes all of your follow-up for the year after your surgery.
Yeah. And I did see that someone had asked about the colon inversion, and yes, we did answer that previously, so we will save this live and you will be able to go back to the start. A few questions which I have and I think are very important is sort of your pre-op. So what does a patient require for them to have the surgery?
Yeah, so the basic things are based on the guidelines that are put in place by WPATH. WPATH is the World Professional Association for Transgender Health, and these are internationally accepted guidelines. So they're things like ensuring that a patient has had a psychiatric and a psychological assessment in readiness for their surgery. And with that, it's about making sure that you don't have any underlying mental health issues that could complicate your surgery or your recovery. This is the big step, and we all have a responsibility to make sure we do the right thing for you. And you always have to ask the question, is this in the best interest of the patient? And everything we do in that preparation is about ensuring it's in your best interest at all times. So things like being on hormones for at least 12 months prior to your surgery, living full time in your gender role are important, and that's all about ensuring that having gender confirmation surgery is the right thing for you at this point in your life. We can't look into the future. We can't predict what's going to happen. Look at the last year. Who would have predicted that we would have been we are in last year? Well, we just can't predict the future. But what we can do is look at the here and now and say, is this patient going to benefit significantly in their quality of life and their ability to function in their chosen gender by doing this surgery? And that's what the operation is about.
Absolutely. And regarding the WPATH guidelines, you actually can check that out online. And you can check out their requirements for everything, for hormone therapy, surgeries, everything. It's all online and you can access that. A few other things which we do require prior to surgery would be bloods and an ECG, which is just routine for procedures. Now, if you have a significant past medical history, we may need to delve a little bit deeper, whether it's cardiology difficulties, anything else which may be significant. We may just need to have a little bit more access to that prior to moving ahead with your surgery, and just checking that out with our anaesthetists first, and just seeing is there any more tests required. But usually it's just bloods and ECG.
Yeah. And then the preparation for the actual surgery, about making sure you understand everything that's going to happen before, during, and after your surgery. The preparation before surgery, very, very important, because one of the greatest risks of this operation, and it is irrespective of technique used, is injury to the bowel. And therefore, it is vitally important that the bowel is completely clean and empty of all fecal matter prior to your surgery. So Laura or one of the team will be going through your diet, when you need to start a low residue diet, when you will start the bowel cleansing medication to make sure that your bowel is completely clean. And that's vitally important. Patients think, oh, well, I can just have a sneaky chocolate bar, or I can have a sneaky, Chinese before your surgery, and that will compromise your surgery, will put your surgery at risk. So for that one time, please avoid the temptation to do anything that's outside of what the instructions that you've been given.
Yeah, and I always like to think of these on like a long-term spectrum, because what you do for those sort of like that pre-operative week or a few days, that's going to benefit you lifelong, and that's where you have to think of it in sort of your lifespan. It is such a small period of time, where you'll be following the diet, having the pre-op boil prep, but think long term, like that's going to be for life, to reduce any risks.
And we've seen, Laura, we've seen patients who've had serious complications following their gender surgery, where they've had massive infections because their bowel hasn't been properly prepared. And those operations and the surgery to try and fix those problems are very complex, involve a lot of time and effort, and therefore you just don't want to go down that road. You want to put a no entry sign on those roads, because it destroys lives. We see patients 5 years, 6 years down the road, and they are still suffering with complications. That for me is an absolute disaster. So you want to get it right. As Laura says, investment of a week before your surgery and a week after your surgery in making sure things are as good as possible and optimum conditions for your surgery is nothing compared to the rest for your next 30 or 40, 50 years of your life. So 2 weeks of heartache, 2 weeks of struggle is nothing when you compare it to the quality of your life for the rest of your life.
Exactly. I see we've got a question coming in just saying, can you talk about accessibility for people of color? So I believe regarding things like scarring, healing, is there differences?
It's a very important question in the modern world. We have always practiced that we treat everyone to the same high standard.
Yeah.
So doesn't matter who you are, doesn't matter the color of your skin, doesn't matter your ethnic background, doesn't matter your religion. We do our best to look after you to the highest possible standard. Yes, there's a lot of implied concern that skin of color may not heal as well, may have more problems with healing. But my experience, having grown up in Trinidad, having worked in Trinidad for many years, and because of my connection, I have operated on and treated thousands of patients of every different color.
Yeah.
And the reality is that it's very uncommon, especially in this type of surgery, that you see problems with scarring, with pore scarring, or with any issues that are different to any other normal human being. We're all human beings. We all have the same anatomy, pretty much. We all have the same issues with our healing, etc. That's programmed into us, and our duty of care to you is to look after you and do the utmost we can to get you the result that you want.
Yeah, no, absolutely. I'm just seeing if any other questions came in. There was just one regarding time off work. How long do we advise time off work post GCS?
Yeah, it's very much dependent on the type of work you do. Or if you're doing a fairly physical job, then really you're looking at minimum of 6 weeks off. If your work involves fairly light duties, then you should be good to go back to work certainly after 4 weeks. If you're working from home, like we have in the present situation around the world, realistically, you'll be fine to start working, after 2 weeks from home. The only thing you've got to be aware of is that this is the big operation.
Yeah.
This is not having a rhinoplasty or having some breast implants. All right, this is the big operation, and you're going to feel knackered.
Yeah.
Right? So even if you think, well, yeah, I can work from home because I'm on my computer. I can do stuff. You'll find that by 1 o'clock, 1:30 in the day,
Yeah.
you feel I need to go and have a rest. And if you've booked up your schedule for the whole day, you're going to be scuppered. So, give yourself time to recover. Yes, do some work. You can do some work on your laptop, but
Yeah.
prepared that your body's going to tell you, honey, we need to go and lie down. So plan for that.
Yeah, absolutely. And I think that's what a lot of patients forget, that it is a very big procedure. And you are under general anaesthetic for a longer period of time than, a breast augmentation or a rhinoplasty. So the general anaesthetic is going to knock you for 6 as well. And like Mr. Inglefield said, you are just going to feel tired. And it's just about listening to your body and resting.
Yeah, giving yourself the opportunity to rest, because what your body is telling you by feeling tired is that it needs time to recover.
Yeah.
When you're resting, your healing is progressing really, really well. If you don't allow your body to rest, then that slows your healing process down. So it is a balance. We want you to be up and about and be active, but also to make sure that you're getting good quality rest, because that's important for your healing.
Yeah. Someone's just asked, would you be able to choose a rough time to do the surgery to fit in with work during quieter times?
Yeah, we try very, very hard. Again, this is all about the standard of care that we aim to provide for you. We try very hard to fit in with your work schedule. For example, if you're a teacher, we will try to fit you in when school closes for the summer, so that you have the whole summer to recover, for example.
Yeah.
If the type of work you do that you are relatively quiet over the winter period, then yes, what we do is we can schedule your surgery for that time when you're going to have some downtime at work, and it's much easier to take time off. So yeah, you tell us what's the best to do, and it's then our job to work out the logistics and planning to try and accommodate those things for you.
Yeah. I see a really good question came in actually. So it says obviously about dilation needs to be done post-operatively. How long does the patient require to do this, and is there anything else which they require to do post-operatively?
Yeah, so what I think you start the question by what is the purpose of dilation. We use dilation post-operatively, really starting from the day the pad comes out, which is on day 5 after surgery, and you dilate 3 times a day for that first 6 weeks, and that tissues are healing. What we wanted to do is to prevent scar tissue from building up, which could cause constriction of your vagina or reduce the depth of the vagina, because the tissue where the vagina is placed, is created, is not a normal area for a trans female patient. There was nothing there before, so you're putting something into where there wasn't anything before. So the purpose of that dilation is to maintain your vaginal depth, maintain your vaginal caliber while that tissue is healing. After 6 weeks, because about 75% of the healing will have occurred in that 6 weeks. After that 6 weeks, you can then start to dilate just once a day. And then we recommend that you dilate once a day for the further 6 weeks. And by 3 months, if everything's healing as we expect, now life is a bell curve. Some people by, earlier than 3 months, by 2 months, they will be very well healed, and there's really no need to continue dilating. Some patients, maybe even up to 6 months, they may need to continue dilating, maybe once a day or every other day. Generally, if everything's healed well by 3 months, most patients shouldn't need to dilate maybe once a week or once every other week. And especially if they become sexually active after that 3 months, then they may only need to dilate maybe once a month.
Yeah.
More just to check that everything's okay and your vagina is well healed.
Yeah, absolutely. And like you're mentioning, it is very patient specific regarding healing processes. So it's really just listening to your own body and how you are healing. I did see another question regarding procedures at the same time. We did cover this previously, and you will be able to watch this again after. And I do see another question regarding sort of past medical history, which we did cover as well. If there's significant past medical history, we may just require more testing prior to the procedure.
Yeah, it's all part of that preoperative assessment and workup. Yeah. We work very closely with our anaesthetists and make sure that any appropriate investigations or review, whether it's with a cardiologist or with a neurologist or anybody else, that we make sure that we have all of the information that we need to keep you safe during and after the surgery. And that's the most important part about that.
Yeah. I do see a question which said, regarding chronic fatigue issues, could this affect the surgery? How could you overcome it?
Yeah, it won't affect the surgery. What is difficult to predict is how the anaesthetic will affect your chronic fatigue.
Yeah.
That's something that, again, we would need to have information about all the investigations that you've had previously and discussions with our anaesthetists, because the anaesthetists, because they have a lot of experience in these type of problems, they can avoid certain drugs during the anaesthetic to minimize the impact that it may have on your chronic fatigue. So again, if we know about these things beforehand, we can make sure we get all the information and we can manage these better for you to ensure that, again, your journey is tolerated, is manageable for you, the individual, and it's not a one size fits all procedure.
Yeah, absolutely. Another question regarding the cost of the surgery. If you drop us an email, we can send you some more information on costs and cost of a consultation as well.
Yeah, good.
And I think that is everything. Is there anything else you want to add, Mr. Inglefield?
Yeah, so I think it's worth just reviewing, why someone would have gender confirmation surgery. Someone who identifies as female and has tolerated or kind of survived having male genitalia for years, many years. Having gender confirmation surgery is such a powerful benefit for that individual, and therefore the responsibility that we take on as within our team to ensure that we achieve an outcome that allows you to live your life in your chosen gender is huge. It is really makes us sit up and pay attention for sure.
Oh yeah.
And because very much our goal is to allow you to have natural appearing female genitalia, which means that in any setting, whether it's going swimming in a pool or on a beach holiday,
Yeah.
changing in a gym, or being examined at your local GP surgery, that you are not scared about anyone seeing you, that you feel completely comfortable, completely natural. And that is an overwhelming drive for me in always trying to do our best and perfecting and trying to get the scars as good as possible. And then the second major goal of that is to make sure that we have a vagina which allows you to have normal sexual relationships, and with good sensation. And good sensation means not only good vaginal sensation, but also good clitoral sensation. So we spend a lot of time reconstructing a new clitoris out of the head of the penis in order to try and maximize that pleasurable sensation, that's going to benefit you for the rest of your life. So these are all things, that we take very, very seriously. We don't rush things. We make sure things are as good as possible before, during, and after your surgery, because it is life changing for sure. But it's also so powerfully beneficial for you to be able to get on with your life.
Oh yeah, absolutely. And even, I find that with our patients coming back at, a week and a half, and they're wearing leggings and they're just saying, I just feel so much more comfortable. And I've had that so many times.
Yeah.
Just so lovely to see that you can see that the whole aspect of their life has just changed. Like they're just over the moon. It's excellent.
Yeah, it's something which most people don't understand,
Yeah.
Laura, because we've been doing it for a few years. That we see it in our patients.
Yeah.
The positive effect that having surgery has on them. I've had patients tell me that oh, thank you so much, I'm so happy that I've got through this. And I say, well, I have prayed every night for 10 years that I wake up as a girl.
Yeah.
Or every time I have to go into a public place, I'm terrified of having to go to the toilet.
Yeah.
Because until they have surgery, they feel very, very vulnerable.
Yeah.
And that's a very distressing situation to be in. And so we see that euphoria after the surgery, and you can understand that, and that real change and real euphoria, the lifting of that pressure and that anxiety has on our patients. And that's why for us it's hugely rewarding.
Yeah.
Because we see the positive effect it has on our patients.
Yeah. And even, from a family member or a friend's perspective, I've had the same family members and friends saying, that the patient just looks and feels so much more comfortable, and they're just so much more confident in themselves. They're really just becoming them.
It's almost like unlocking that spirit,
Yeah.
allowing it to flow freely.
Yeah.
Universe, I just said image that I love. It's that before surgery, it's almost that caged spirit, and you unlock that spirit and allow it just to float free, and it's wonderful to see with our patients.
Yeah. No, absolutely. I think that is everything.
Yeah,
Yeah.
brilliant. Fantastic. Well done. Thank you, Laura, and thank you everyone for joining us. I hope that was helpful. As Laura said, we will be posting this on our Instagram feed, so you can go back and catch up on any points that you missed. If you have any further questions, please just send them in to Nicole, and Nicole can answer a lot of the questions, or she can pass them on to me. And if there's any burning thing that you need, don't hesitate to let us know. We're here to support you. We're here to educate, and we're here to guide you as best we can. So keep well, guys. Look after yourselves and your loved ones, and hopefully see you soon again.
Yeah, stay safe and see you soon. Bye-bye.
Bye for now.